What's up, y'all? New Dad here, and today I want to talk about coronavirus during pregnancy. What's up, y'all? New Dad here, and today I want to talk about pregnancy during coronavirus. Now, first in admission, I'm still a new dad to be. My wife is currently 8 months pregnant, so we're at the home stretch. And conceivably, that means that we conceived in October, and my wife was just 4 months pregnant when coronavirus hit the US. And unfortunately, my wife is in the medical field, and that made us a whole lot more worried about the whole thing. For the moms and dads to be out there, we really don't know how long coronavirus is going to be with us, and I do hope that someday soon they will find a treatment and a cure for this disease, and people can go back to having normal pregnancies. But for now, we're just going to have to make sure that we keep mommy safe and from taking any unnecessary risks. In my next video, I'm going to talk a little bit about the up-to-date research that's coming out about coronavirus and pregnancy. But for now, I'll just mention that just this week, the CDC released some new guidelines that suggest that pregnant women who get COVID-19 are much more likely to be hospitalized and suffer from severe illness than women who are not pregnant. And my personal theory is that the COVID-19 quarantines are going to cause another baby boom, and that means that we just have to be super vigilant about keeping pregnant moms safe. That being said, there does need to be a balance. Pregnant women do need to get exercise, get out of the house, get some fresh air. It helps them stay healthy and also keep their sanity, and especially dad's sanity, during pregnancy, which is already a pretty stressful period. We actually have a nice park that's just a few minutes drive away from us, and we used to go there every evening during the first few months of pregnancy for a nice long walk. However, after coronavirus hit and people started staying home for work, we noticed that the parks were getting fuller and fuller, and people really weren't keeping the social distancing. You had joggers coming by and going like, whew, just exhaling everything on you as they passed you by. So that made us feel very uncomfortable. Now, we can only control ourselves. You can't start running after people and yelling at them not to breathe on you. So we decided to move our evening walks to the neighborhood, which admittedly isn't as nice as the park, but you do get that exercise every day. You get to have some fresh air and stay healthy. And so it's important to be flexible about these things. Another thing we had to change was our grocery shopping habits. So my wife and I love to go every weekend to do grocery shopping together, pick out all the foods we want to cook for the week. However, despite her protests, I thought that it was safer for her to stay home and me to go do grocery shopping on my own. I also stopped going on the weekends when the supermarket is packed and started going middle of the week, after dinner, pretty late, close to the closing of the grocery store. That way there's not a lot of people, and I also minimize my interactions with other people and anything that I could potentially bring back home to my pregnant wife. And the important thing is just to remember to stay flexible. Pregnancy and children are going to have to cause you to change your habits at some point anyway. And so coronavirus is just getting you training to do that a little bit earlier than you expected. Now, I mentioned earlier that my wife is in the medical field, and other people are going to have other circumstances which basically don't allow mom to stay home and be kept safe in a bubble as dad would like to keep her. For my wife, it was very scary at the beginning when nobody knew anything. Really, the healthcare professionals weren't even wearing masks at that time when they were dealing with patients. But now we have a lot more information, and we know how to keep each other safe, and the culture has kind of come around this. So we need to just support them, and even though we can't minimize the risk by 100%, it's important to take control of what you can do. And it's also important for mom, whenever she feels unsafe or uncomfortable, to voice her concerns. So pregnant women draw a lot of attention. Everybody wants to touch the stomach and ask her when she's due and how the baby's doing and what's the gender. Somebody's getting in your personal space. Don't be afraid to say something. And husbands, encourage your wives to stand up and speak out against people who are kind of getting a little too close. Now, other than our health and safety, there are some other aspects that were affected in our pregnancy due to coronavirus. For us, my parents-in-law live just a few hours drive away, and when we got pregnant, they started coming down every month to have dinner with us and visit. And as soon as things started getting pretty serious with coronavirus, those visits stopped. And so depending on your personal situation, maybe you have less or more difficulty seeing the rest of the family, but you may need to prepare for having a little bit less family support during these 9 months of pregnancy that you might have during normal times. Another big thing for some people is baby showers. Baby showers may not be as practical a thing to do right now. Personally, my wife and I weren't planning on doing a baby shower anyway, but it is a big deal for some people, and it's also a way for people to get some of the baby things that they need without spending as much money. So you may need to think about some creative ways that you can organize a baby shower, maybe something virtual, or maybe an outside picnic where there's a little bit less risk and people can kind of social distance. But the baby shower is probably not going to look exactly how you expected, and just have to accept it and make the best of the situation. Another thing that's taking a big hit due to coronavirus that we've noticed is baby classes. So for us, we did have an interest in taking some of these classes, but they're being given at a very reduced capacity here in Texas where we are. It may be different in other places, but they do have to keep it to a maximum amount of people to allow people to social distance. And so that means that if you have any interest in taking these classes, which I highly recommend, you may need to plan a little bit ahead of time, look for these things and register for them ahead of time so that you can get a spot in them. My wife and I attended the breastfeeding class and the newborn essentials class, which I thought were really good and had a lot of high value information. And these classes are given for pretty cheap. Some of the classes are given for free. The ones we took were $10 for the both of us for like a 3-hour class. And I really think you get a good bang for your buck doing these things. So if you do have interest in that, try to plan early now that coronavirus is affecting some of the schedules of these things. Finally, and probably most importantly, the birth and recovery phase of this whole journey is going to look a lot different than it would during normal times. Places like New York had at some point the insane idea that you could just let the women go in and do everything on their own, and dads weren't even allowed in. They pretty quickly realized how inhumane that was and canceled that order, but most places, at least here in Texas, they're only allowing one person in with the delivering mom. And so if you had plans for having a doula or having one of the moms in the delivery room, you may have to reconsider that. Maybe you can come up with some creative ways to do that, like doing it virtually, of course, assuming that your care provider and the hospital regulations allow you to do that. Or dad, you're gonna have to go and do some labor coaching classes and just take on that role as well. Another thing is that the family won't be able to come visit while you're recovering in the hospital, so make sure that you have everything you need prepared in advance so you don't have to go back and forth to get things while your wife is there and may need your support. And also think of creative ways that you can share the experience with your family by making videos, things like that. Be prepared. And also find ways to entertain you and your wife while you're stuck in the hospital for 3 days before you can go home with baby. So those are just some of the observations that I had during our pregnancy and how coronavirus affected us. Please feel free to leave in the comments experiences that you've had that I may have missed that could be important for other parents coming into this journey. And as I mentioned, I will do a future video with some of the more scientific research information that's coming out about the effects of coronavirus on pregnant women. But to end this on a good note, I'll just leave you with this. When does a joke become a dad joke? When the punchline becomes apparent. See y'all soon. Stay healthy.